Hi, Dr. Tamilio here with the next lecture, some reflections on Chapter 4 in the course textbook, which deals with the issues truth-telling, confidentiality, right to privacy. These terms exist outside of medical ethics. We think of them quite a bit. In fact, I think we take them for granted. Truth-telling, for example. We expect people to tell us the truth. We get upset when they lie to us. According to Immanuel Kant and his categorical imperative, which we discussed earlier in the course, if people didn't tell the truth, if they willed for lying to become a universal norm, then we wouldn't be able to communicate with one another because we wouldn't know when people were lying. We'd actually have to assume that they are lying, and so communication would be impossible. Well, in the doctor-patient relationship, it's a little bit different. We expect doctors to tell us the truth. And in fact, doctors want to tell us the truth. They want us to know our diagnosis. They want us to know the prognosis. In part because well-informed patients make better patients. If you are well-informed, you're more apt to work with your doctor in the process of healing, in the process of finding a cure. So we don't expect our doctors to lie to us. But this wasn't always the case, and it certainly still isn't the case in some cultures. In some cases, it's assumed that, depending on the situation, a doctor might lie to you to protect you. Say, for example, you have a history of depression, and let's say you have a history of suicidal ideation. And your doctor knows this and diagnoses you with cancer. Well, your doctor telling you this might be dangerous for you because the doctor may fear you might commit suicide if you hear a diagnosis, if you hear that C word, cancer, right? That you might take your own life, or it might lead you into who knows what. So, at one time it would be expected for doctors to lie to you to spare your feelings, to help you. But nowadays we don't really expect that. In fact, I think we would hold doctors legally responsible if they didn't tell you the truth. I think most of us would. So we expect that doctors will not lie to their patients. There's a sidebar in the text. Do patients want the truth, or do physicians tell it? And it reads this. It says, in 1961, a survey of physicians found that 90% of them would avoid telling patients of a diagnosis of cancer. But in a similar 1979 survey, 97% of physicians said that they would disclose a diagnosis of cancer. Look at that change within 2 decades, right? 1961. 90% of doctors would avoid telling patients of a diagnosis. 1979, 97% of physicians said they would disclose the diagnosis. Likewise, it also says more recent research suggests that most physicians in the Western culture inform their cancer patients of their diagnosis, but fewer of them tell cancer patients about their prognosis. Several studies indicate that most cancer patients want to know the details of their disease, whether the news is good or bad. Surveys suggest that patients differ in the kinds of medical information they would like to have and how it is communicated to them. Some people say that it is impossible for physicians to tell their patients the truth, because if a physician was to tell the patient everything that he or she knows, the patient wouldn't understand it. There's a lot of technical language and advanced knowledge that doctors have that isn't easily translatable, if you will, to patients. So some people say that doctors often do lie in the sense that they can't tell their patients everything in a way that their patients would understand. Well, that aside, and that may be true, that aside, doctors can still tell us what we need to know. They can give us, they can use clear lay language and tell us what our diagnosis is. and what our prognosis is. And more people expect to hear that. They want to know that, good news or bad, right? So it's become a sort of ethical standard that doctors will disclose the truth. Now, there are case studies that sort of challenge this and counter that. I'm going to kind of leave that aside for now. The other issue has to do with confidentiality. Now, according to Lewis Vaughan, confidentiality concerns patients imparting information to health professionals who promise implicitly or explicitly not to disclose that information to others. Now, we all know about doctor-patient confidentiality, whether it is in the medical setting or maybe a therapeutic setting. If you have a therapist, that same type of confidentiality exists there. It also exists in religious corners. If you have a minister or a priest or a rabbi and you confide in that person, whether it's through confession or whatever it happens to be, you expect, just as if you talk to a doctor, that information is going to be held in confidence. We value confidence. It has to do with trust, right? It's very hard to be totally open and truthful with someone if you don't know that person is going to keep all conversations confidential. Some of you might be mandated reporters. I know I'm a mandated reporter as a college professor. I'm a mandated reporter. As an ordained minister, I'm actually an ordained minister in the congregational tradition, and I am sworn to confidentiality in that context as well. People are allowed to break confidentiality if the patient reveals to, say, the doctor or the therapist or whomever, that they're either hurting someone or they're going to hurt someone or they're going to hurt themselves. And the doctor or the pastor or the therapist really truly believes the person is going to do that. They're not just speaking out of pain and frustration. They're serious, and the doctor or therapist knows that. Then you are a mandated reporter if a patient reveals that they're hurting their child or abusing their wife or anything like that at all. That has to be reported. You're a mandated reporter. If you don't report that, you can be held liable. Now, aside from those very crucial situations, we expect doctors and ministers and therapists and whomever we confide in to keep our information, to keep the conversation confidential. Now, what happens when you have a situation where breaking confidentiality is crucial, is necessary, might save a life? Make sure you read the classic case file in the text about Carlos R. This is a story about a young man who is HIV positive, and he is also, if I remember correctly, in a gang, and he's wounded. And he goes to the doctor, and it's reported that he's HIV positive, and he's being discharged from the hospital, and his sister agrees to care for his wound at home. The sister doesn't know he's HIV positive, and Carlos, for cultural reasons, doesn't want her to know. Does the doctor have a duty to warn? Does he have a duty to tell the sister? Or is Carlos's right to privacy more important? These are issues that come up, and they come up more often than you'd think in the doctor-patient relationship. They come up again and again, where confidentiality, the right to privacy, and the duty to warn don't always gel. So you need to be thinking about that. You need to be thinking about ways in which that is the case. And some of the cases, the case studies, the cases for evaluation at the end of the chapter are going to help you with that immensely. And so I encourage you to read those carefully. So make sure you understand the terms confidentiality and all that means, as well as right to privacy right? That patients have a right to privacy, and how that can come into conflict with the duty to warn. Because remember, when we talked about the Hippocratic Oath, that doctors are supposed to, they're to seek beneficence always, right? The health and safety and well-being of their patients, right? Well, maybe breaking confidentiality is one of the ways in certain scenarios that they ensure that beneficence, right? Or it could be the duty to tell, the duty to inform another person might be in the best interest of the patient, even though the doctor would be breaching, a fundamental tenet, really, of medical ethics, confidentiality. So make sure you read through this chapter. Think long and hard about confidentiality, the limits of confidentiality. Think of a doctor's duty to warn, a duty to tell others. Think of the whole concept of truth-telling. When these issues, in and of themselves, I think these issues are pretty clear. The problem is when they come into conflict with one another. And that's what I want you to be thinking about as you go through this chapter, okay? And make sure that, at the end of the chapter is the case studies. Read those. And then there are additional readings, and I pointed out a couple of them that I want you to read, so be sure that you do. We do have an exam coming up. I don't have my notes right in front of me. I believe the exam, I know it does cover the predominant theories we talked about in the first part of the class, and it covers these last two chapters, chapter 3 and 4. So you have the foundation. This is the applied ethics, where you take the learnings of Aristotle, Kant, Bentham, Mill, Ross, where you take issues regarding cultural relativism. Cultural relativism actually has a lot to play with this whole truth-telling and confidentiality issue, particularly within Latina culture, also in Italian culture. There's a lot of differences, cultural differences about how we approach this. But anyway, we talked about that. We talked about religious ethics. How does all this come into play when we apply it to actual issues? So be thinking of this chapter. If you have any questions at all, please feel free to call me or to email me. You have my contact information. Otherwise, keep being ethical, and I'll talk to you soon. Take care.